happen to be the biggest epidemic that you've never heard of. I am the economic disaster that no one speaks of. I destroy families, terminate careers. I annihilate people. And yes, I cost you 7 billion shekels every year. You are certain that addiction only happens at the peripheries of society, that I exist in every socio-economic group, in every age group. I harm 500,000 Israelis directly, as well as everyone around them. And if you think addiction is a matter of choice, and that people who suffer from addiction are of weak character, then you are completely missing the point. Only when you look addiction straight in the eye can you see it is a health problem that can be treated. The first step is to open your eyes.
One of our major goals in establishing the Israel Center on Addiction was to develop evidence-based, up-to-date standard of care for addiction treatment throughout the country. To this end, we developed what we call the ICA campus.
As an Israeli citizen, I'm very proud of the Israeli healthcare services. It really is a true wonder. But as in any wonder, there are also some blemishes. And unfortunately, addiction is one of them. The Israeli mental health care reform of 2015 carved out addiction, and we're set to change that. We have set up ICA to speak for all those who have no voice.
What does the Israel Center on Addiction do? Policy, promoting legislative change to create a reform in the field of addiction. This will enable accessible and affordable treatment for all those who seek it. Research. Our research department has amassed data on addiction in Israel. We've enlisted pro bono partners to help us produce groundbreaking research for the first time in Israel. Training. ICA has become the national training center for the treatment of addiction and prevention. It offers 2 tracks: an intensive 2-year postdoctoral fellowship training clinicians for addiction treatment. Our goal is to create a cohort of 250 specialists who will enter the public healthcare system and become change agents in the field of addiction. We offer various short-term training tracks. Over the past 3 years, we have trained over 5,000 relevant people from all walks of society. Treatment. Our clinic treats 400 patients at any given time. We track every patient for a 2-year follow-up post-treatment. Our success rate in treatment is over 72%, higher than any other mental health disorder in Israel. The idea was to create a prototype, a model clinic which would eventually be replicated by our national healthcare providers. Prevention. ICA has developed Israel's first school addiction prevention program. This is a weekly intervention program over the course of 2 years, reaching over 50,000 students to date. This is one of Israel's most effective school intervention programs and has decreased use of substances, harmful behaviors and screen time in a drastic manner. Together, we are spearheading the treatment and prevention of addiction in Israel and promoting the mental health and resilience of our society.